Most people expect to have a healthy and uneventful pregnancy, but unfortunately, this is not always the case. Research and medical developments within the field of pregnancy are not necessarily as advanced as within other fields of medicine. As a result, a full 10% of babies are born prior to full gestation, and maternal mortality has actually been increasing in developed countries. By some estimates, half of those deaths could have been prevented. The statistics are even worse for Black women in America, who have terrible outcomes, even controlling for other factors such as income level and health status prior to pregnancy. And of course, all of this was put into stark relief in the last year when pregnant women were left out of clinical trials for COVID vaccines, leaving especially pregnant healthcare workers vulnerable and in a position of having to make blind decisions about whether or not to be vaccinated. Overall, pregnancy is a relatively understudied area of medicine, and it's not an area in which engineering and physics have typically had a huge part. And today I'm going to tell you about some of what we're doing to try to change that. We all know how pregnancy begins. Sperm meets egg, and the fertilized egg somehow has to then eventually develop into a full baby. Those earliest stages of cell division after fertilization involves separation of the cells into two different types of cells, the ones that will eventually become the fetus and the ones that will become the fetal support network, including the placenta and the placental membranes or fetal membranes. And these are the aspects of pregnancy that I, an engineering professor, have been studying for the last 15 years. The first study I'd like to tell you about is using microfluidics or organ-on-a-chip approaches to study the early development of the placenta. So here we've taken trophoblast cells from the first trimester and put them in a device in a hydrogel environment and exposed the hydrogel and the cells to a chemical gradient of a cytokine molecule that's known to be associated with pregnancy. And in the graphs on the right, you can see that the cells move in a directed manner towards the chemical when it's been added, whereas in the lower right-hand picture, you can see that without the chemical gradient, the cells move in a random way. So we're trying to use this model system to study different types of chemicals that may be associated with successful implantation and early development of the placenta. The early implantation of the placenta into the uterine wall then manifests itself in the third trimester in some problems in pregnancy if the placenta has failed to develop correctly. We are studying this using specimens of tissue that we obtain after birth from healthy babies, and we use the tissue to image in 3 dimensions the natural structures of the capillaries in the blood network in the placenta and the tissues and the interface between the mother and the fetus. And we can model, using computational approaches, the oxygen diffusion and the blood flow in the natural functioning placenta and try to understand what happens when this goes wrong. The third system we've been exploring from an engineering perspective is the breaking of waters, or the rupture of the fetal membranes when birth is imminent. And in this process, you have this very interesting material that has a collagen fibrillar network, and we're studying the fracture mechanics processes both experimentally and computationally to try and understand why sometimes these membranes rupture prior to full-term gestation, and this is a leading cause of premature birth. In this taster presentation, I've given you some examples of how my own research group is using engineering approaches to study different aspects of pregnancy. And we're only one group of a growing number of groups across the world studying pregnancy using these engineering and physical sciences approaches. And we're very excited at the growth of this field and looking forward to hopefully intervening to help with diagnosis, prevention, and treatment of pregnancy problems using our engineering approaches.